palpation of the knee joint. For positions, I can have my patient in sitting, as I can access most 3 of the 4 portions of the knee joint, with the posterior portion being found when the patient is lying in prone. First, I will palpate for the base of the patella. Now, coming from the femur, moving distally, the first bony landmark I should feel is the patella, and the base of the patella is more proximal to the femur than the apex of the patella. Coursing around it, I can feel the general size of this patient's patella. And then moving distally, I will be able to palpate for the edges of the patella. Now, if I'm having trouble, what I can do is ask the patient to go into extension. I can sublux the patella slightly and get a better idea of the edges of the patella. Go ahead and relax. And then coursing distally, I would continue down until I reach the apex of the patella, which is approximately right here. Next is the patellar ligament, which simply requires me to continue down, moving through until I start feeling a soft tissue-like, and this can orient myself with the patellar ligament, excuse me. Lastly, for the anterior aspect of the knee joint is tibial tuberosity. Simply continuing down the patellar tendon, I will feel a bony prominence right about here, and that's the approximate location of the tibial tuberosity. Next, I will be palpating for the medial portion of the knee joint. Starting with the boundaries of the medial joint space. These include the tibial plateau and the medial condyle of the femur. So for the tibial plateau, coming from the tibial tuberosity, I would move medially, feeling for that bony prominence that is the medial tibial plateau, which I can feel right about here. And then for the medial condyle of the femur, coming from the patella, I would move medially until I feel a bony prominence and trace that around to get the idea of the femoral condyle, which I can feel mostly around here. So between the 2 bony prominences is the joint space of the medial knee joint. Next is the medial epicondyle of the femur. So from the medial condyle of the femur, I would move proximally, feeling for a bony prominence, which I can feel right here, being the medial epicondyle of the femur. Next is adductor tubercle. So moving even more proximally from the medial epicondyle, I can feel that you feel that bony prominence? I can feel the bony prominence slightly proximal to the medial epicondyle, which I discovered was right here. From that, from the adductor tubercle, I can palpate for the adductor tubercle tendon, which if I provide some traction, I'll be able to feel the tendon moving within it. And I can confirm this by pushing my patient into abduction and him resisting. So push into my hand. And I can feel the tension right there coursing along the adductor magnus muscle. So next is the saphenous nerve, which can be found on the medial aspect of the knee. Going along the medial knee, I would provide gentle anterior to posterior movements until I begin to feel that rope cord-like texture that we associate nerves with. And I can also have patient input to provide me any feedback. Tell me what it kind of feels like. I'm feeling it right here as I'm kind of getting that ropey feel.
Yeah.
Next is the pes anzerinus muscle group, being from anterior to posterior, sartorius, gracilis, and semictendinosus. From the medial knee, I would feel for those 3 tendons and I can feel them right here. If I would have him go into some movements of the knee joint, I can feel the tension. Sorry. Yep, I can feel those tendons tense up. Next, I will be palpating for the lateral aspect of the knee joint. So for the boundaries of the joint space is in a similar fashion as finding the joint space of the medial knee. So, from tibial tuberosity, I would palpate laterally along it until I get the orientation of the tibial plateau. And once again, for the femoral condyle, from the patella, course along, feeling for the convexity of the bone, and approximately right here I can feel for the joint space. Now, one other structure that I missed on the medial aspect is the medial collateral ligament, which courses should course from the medial epicondyle to the tibial plateau. So, similar to the saphenous nerve, if I go along and find the connection point, I'll feel soft tissue, which I feel right here, which indicates the medial collateral ligament. And pushing his knee into varus, I can feel that resisting. So anyways, back to the lateral aspect. So the joint space I have approximated. So moving along this lateral condyle, I can move proximally, and again, I should palpate for the lateral epicondyle, which I can feel right here, the bony prominence, and there is condyle, epicondyle. Head of the fibula, so starting from the tibial plateau, if I move distally, not a whole lot, I can feel for that femoral head within this area. Yep, and there's the bony prominence indicating the fibular head. For the lateral collateral ligament, it goes from the lateral epicondyle to the head of the fibula. So orienting myself, I have the idea of the ligament. And then if I do some traction right here, I'll feel what doesn't feel like bone or doesn't feel like a joint space, but feels like tissue, and I can feel it right here. It feels a bit more broad compared to and a bit stronger compared to the MCL. So right here is the lateral collateral ligament. Yep, I can feel that tension. So as well on the head of the fibula is the tendon of the biceps femoris muscle, which I can feel right here just a little bit posterior to the head of the fibula. And then lastly on the lateral aspect is the common fibular nerve, which using the head of the fibula, I would be able to feel for. It should wrap around this head. So again, I can provide that traction until I feel that string-like cord, which I can feel right here, and that indicates the common fibular nerve. Does it feel nervy?
Yes.
Okay. And then lastly is the posterior aspect of the knee joint, which I'm going to ask my patient to lie prone with his head facing that way. Now, the majority of palpating for these really comes down to knowing the anatomy. So within the popliteal fossa, I will feel the tibial nerve and the common fibular nerve as well before it wraps around the head. So the more lateral portion should be the common fibular nerve, and I can feel that. I can feel that string-like cord indicating common fibular, and then moving medially within the popliteal fossa, I should be able to feel for the tibial nerve. And sometimes with all those structures, I'll need to palpate a bit deeper to get into them. And yep, I can feel that string-like cord indicating the tibial nerve. Next is tendon of biceps femoris. So, as it is on the lateral portion of the knee, feeling around that lateral portion when I feel the tendon, it won't feel quite string-like, but it'll still feel, it'll have some resistance. And I can feel it right there, confirming for the tendon of biceps femoris. And then finally, the tendons of the pes and Zerinus muscles, they'll be on the medial portion, going towards the medial knee. And a way I can help confirm this is by having the patient go into flexion, and I can really feel those tendons now. As well, I can feel the tendon for biceps femoris in this better kind of position. And that is palpation of the knee joint.